Sleep and pregnancy. Why rest matters more than ever. Pregnancy is often described as one of the most beautiful and transformative times in a woman's life. It's a journey filled with anticipation, joy, and yet, from morning sickness to mood swings, from backaches to food cravings, a woman's body goes through profound changes while nurturing new life. Amidst all these physical and emotional shifts, there is one crucial aspect that often gets overlooked: sleep. Many pregnant women quickly discover that getting quality rest is not as easy as it used to be. Tossing and turning, frequent trips to the bathroom, leg cramps, and an active baby kicking at all hours can turn bedtime into a nightly struggle. However, sleep is not just a luxury during pregnancy, it is a necessity. It plays a critical role in the health of both the mother and the developing baby. So today, let's dive into why sleep matters so much during pregnancy, how to improve it, and why healthcare professionals emphasize one simple but powerful message. Pregnant women, get a good night's sleep. Prioritize quality sleep and, if possible, sleep on your side to improve circulation. The importance of sleep during pregnancy. Sleep is the body's natural way of restoring energy, repairing cells, and regulating hormones. For pregnant women, these processes become even more vital. Here's why. Physical recovery. Pregnancy puts a great deal of physical strain on the body, from supporting the growing uterus to adapting to hormonal changes. The body needs time to recover. Sleep provides this essential downtime. Hormonal balance. Sleep helps regulate hormones like cortisol and insulin. Proper hormonal balance reduces the risk of gestational diabetes and immune support. A strong immune system is crucial during pregnancy. Quality sleep supports immune function, helping to protect both mother and baby. Fetal development. Sleep promotes healthy growth and brain development in the baby. A well-rested mother provides a better environment for fetal health. Why is sleep harder during pregnancy? Despite knowing how important it is, many pregnant women struggle with sleep for various reasons. Frequent urination. As the uterus grows, it puts pressure on the bladder, especially at night. Heartburn and indigestion. Pregnancy hormones relax the muscles in the digestive tract, leading to more frequent heartburn. Leg cramps. Sudden muscle cramps, often in the middle of the night, are common in the second and third back pain. The extra weight and shifted center of gravity can strain the lower back. Anxiety and stress. Emotional changes and anticipation about labor and motherhood can cause restless nights. The best sleep position for pregnant women. Among all the advice given to expecting mothers, one recommendation stands out. Pregnant women, get a good night's sleep. Prioritize quality sleep and, if possible, sleep on your side to improve circulation. Why is sleeping on your side, particularly the left side, so important? Improved blood flow. Sleeping on the left side improves circulation by reducing pressure on the inferior vena cava, the large vein that returns blood from the lower body to the heart. This helps both the mother and the baby receive better blood and oxygen supply. Better kidney function. Left side sleeping supports the kidneys in efficiently removing waste products and fluids, reducing swelling in the ankles, feet, and hands. Reduced risk of stillbirth. Some studies suggest that left side sleeping reduces the risk of stillbirth in late pregnancy. If sleeping on the left side feels uncomfortable, using pregnancy pillows for support can make a significant difference. Placing a pillow between the knees or under the belly can relieve pressure on the back and hips. Sleep tips for pregnant women. Improving sleep quality during pregnancy often requires making small but meaningful lifestyle adjustments. Here are practical tips. Create a bedtime routine. Establish a calming pre-sleep routine. Listening to soft music or taking a warm bath can signal your body it's time to wind down. Limit screen time. Reduce exposure to screens at least an hour before bed. Blue light can interfere with melatonin production, making it harder to fall asleep. Stay active. Gentle exercise during the day, like walking or prenatal yoga, can improve sleep. However, avoid vigorous activity too close to bedtime. Watch your diet. Avoid spicy or acidic foods that trigger heartburn. Also, limit caffeine intake and drink plenty of water earlier in the day rather than close to bedtime. Nap wisely. Short naps during the day can help with fatigue, but avoid long naps that might affect nighttime sleep. Use support pillows. A full-body pregnancy pillow or extra cushions can help support your belly and reduce back pain. Mind your sleep environment. Keep your bedroom cool, dark, and quiet. Consider blackout curtains or white noise machines if needed. Practice relaxation techniques. Meditation, deep breathing exercises, or guided imagery can help reduce anxiety and prepare the mind for restful sleep. Listening to your body every pregnancy is unique. While some women may sleep soundly through all 3 trimesters, others may struggle nightly. The key is to listen to your body and make adjustments as needed. Don't hesitate to talk to your doctor or midwife about any persistent sleep issues. Sleep disturbances like insomnia, sleep apnea, or restless leg syndrome can sometimes emerge during pregnancy and may require medical attention. Never ignore prolonged sleep deprivation, especially if it's affecting your mood, energy levels, or daily functioning. Emotional benefits of sleep. It's easy to underestimate the emotional impact of poor sleep. Pregnancy often comes with heightened emotions, joy, worry, excitement, and fear. Lack of sleep can magnify mood swings and increase the risk of prenatal depression and anxiety. A good night's sleep helps regulate mood, improve patience, and provide mental clarity, essential qualities for managing pregnancy and preparing for motherhood. The long-term perspective. Sleep now for a healthier postpartum. There's a common joke that pregnancy prepares women for the sleepless nights that come with newborn care. While it's true that parenting a newborn often involves interrupted sleep, this doesn't mean that sleep during pregnancy isn't vital. In fact, getting as much quality rest as possible before the baby arrives can help build physical and emotional resilience for the postpartum period. Well-rested mothers often experience quicker postpartum recovery, better breastfeeding success, and lower rates of postpartum depression. When to seek help if you experience any of the following: talk to your healthcare provider. Severe insomnia lasting more than a few weeks, snoring, accompanied by gasping or choking, persistent leg cramps or restless legs, severe heartburn that doesn't improve, with dietary changes, feelings of anxiety or depression that interfere with daily life. Sleep is not just about comfort, it's a health priority. Final thoughts. Pregnancy is a time of nurturing not just the new life growing inside, but also your own health and well-being. While it may feel difficult at times, making sleep a top priority is one of the best things you can do for yourself and your baby. So tonight, dim the lights, find a comfortable position, and remember this simple yet powerful advice. Pregnant women, get a good night's sleep. Prioritize quality sleep and, if possible, sleep on your side to improve circulation. You and your baby will be better for it.